Hi, I'm Cindy Conine. I own Global Physiotherapy in Sherwood Park, and I'm introducing a series where I'm going to interview all the different experienced physiotherapists on staff. And today I have the pleasure of introducing Leasa Stanley, and we're going to get to know Leasa a little bit more. So Leasa, it's been 4 years that you've been part of our team at Global Physiotherapy. It's crazy how the time has gone by. And so I wanted you to talk a little bit about your background. So how about talking about where you got your physiotherapy education?
Okay, well, I'm from Nova Scotia. I got my physio degree from Dalhousie. I graduated in the year 2000. I'm dating myself, but I graduated in the year 2000. And I moved out here. I worked in Nova Scotia, outpatient ortho, same as this clinic, for 7 years. And then I moved out to Alberta, and I've been here ever since. And I really enjoy working here.
And we are so glad you joined our team, for sure. So you're from Nova Scotia, which is cool because you bring some experience from another part of Canada, which I think is great that our patients benefit from. I know you're saying you're dating yourself, but you worked in orthopedics in Nova Scotia and here in Alberta. So approximately how many years experience practicing physiotherapy do you have?
23 years I've been doing this.
Yeah, awesome.
Yeah, crazy, yeah.
And I think what we should share next is your commitment to lifelong learning. You've done a lot of education over the years. How about highlighting a couple of your key qualifications that you've accomplished that influence how you practice physiotherapy?
Okay, well, I did the Canadian Physiotherapy Manipulation and program. So I am a fellow of the Canadian Academy of Manipulative Physiotherapists, FCAMPT. And let me tell you that any physio that has those qualifications has worked very hard over a long time.
Very true.
Including practical exams in Vancouver and years of courses. So that's really helped me with manual therapy, with exercise therapy, with so much. Just being able to put the whole picture together when the patient comes in and tells you their story, it's really been really helpful. I can't imagine if I hadn't done that. Another thing that I use every day is intramuscular stimulation, otherwise known as IMS, which is a type of needling that we do here. I also took Mackenzie. It's a whole other stream of courses that you take over a period of years, also with exams, that it focuses more on the mechanical and movement part of treatment and diagnosing, and also focuses on a type of exercising, which I use also every single day. I'll always find someone with some kind of need for that type of assessment and treatment. So those are the three biggies. I've done some training with babies with torticollis, and Shirley Sarman, which is kind of a movement, she's more like a movement, exercise, balance type of a course, which is also really, really good to be able to get the whole picture of how the different parts of the body, affect our movement. And so that's the gist. That's the main parts of it. But I've taken courses. We're always all taking courses, so it's important to keep up with it, because you can have 23 years experience and still be doing what you were doing 23 years ago. So
100%. And so I think Leasa really illustrates our philosophy of global physiotherapy, because she mentioned a couple of times with the courses that she's taken that it really looks at the whole body in terms of looking at what kind of problems somebody has. And as you notice, she mentioned exercise more than once, because we want people to learn how to help themselves stay better. And that's a big part of our philosophy here. So let's talk about some of the conditions that we see that people benefit from receiving physiotherapy. So Leasa, how about talking about people who are injured in a motor vehicle accident, and they can happen year-round. There are, we do tend to have people injured in motor vehicle accidents perhaps in the winter season more, but we definitely see people all year round who've had that kind of an injury. So when someone comes to see you after a motor vehicle accident, what do you see and why is it important to receive physiotherapy after you've been involved in a motor vehicle accident?
So with motor vehicle accidents, the most common thing we see is whiplash, where they've injured their necks. We also see low backs, and really you can sprain, you can have other injuries as well, but those are by far the most common. And motor vehicle accidents is a industry that's very expensive to insurance companies, and therefore there's a lot of research into how to get people better after an accident. It's not a guessing game. We all know that they need to be treated, the sooner the better. The sooner they get into physio, the sooner they get back to their life, the sooner they start moving again, the better. So if we can get people in right away, the next day, within a week to 10 days for sure, it's better. We can guide them, appropriate ways to return back to their normal activities, should they or should they not, and to what extent, and appropriate exercises. No two accidents are the same. They're not the same. There's different angles, there's different speeds, there's different people. There's no two accidents that are the same. There's no two whiplashes that are the same. So it's really important that they get individualized, specific assessment, so that we can treat them and their exercises are going to be individual, their treatments are going to be individual, and therefore it's not really a generic treatment plan. But it is very important to get them in sooner rather than later. It's not even a question. It's just known in the research. And
what we can reassure people is that your motor vehicle insurance policy covers receiving treatment for physiotherapy, and that you can choose who you receive your physiotherapy treatment from after a motor vehicle collision. So you can do a bit of research yourself, and we encourage people who choose us to read Google reviews and learn how people have appreciated receiving the kind of treatment that we provide here. And so you talked about getting people back to their normal activities. What if somebody just has a stiff neck after their accident? Would they still benefit from coming in for an assessment, Leasa?
Oh, for sure, yeah. They would still need an assessment. Yeah, because you might have a stiff neck. You might think, oh, it'll be fine. I'll just give it a couple weeks. And it might be fine, but it might not. And if it's not, then it's harder to treat later than it is to treat sooner, for sure.
Yeah, because I think sometimes people think, oh, I'll just leave it. But then when we assess them, we may find some other issues, and then they realize, oh, gee, I'm having trouble standing at work, and it's having an impact on their day-to-day.
And on the other end of the spectrum too, if people are really, really injured, sometimes they're in a lot of pain and they think they can't go to physio. But just know that we are we're very respectful of that. We don't push you. If you're in a lot of pain, that's a whole other type of treatment. It's not that you shouldn't come at all. It's so that if you do come, we're going to be much more gentle, still very specific, but you should still come, rather than thinking I can't go to physio because I'm in too much pain. Sometimes people do think that. So it's important to come either way.
Yeah, and movement is good.
And,
it would
just be gentler movement at that point. Yeah.
And so that's great, Leasa. So why don't we talk about another kind of problem that you treat quite often, low back pain.
Yeah.
And so why don't you talk about what you see when someone comes in with low back pain, and how you integrate your experience and a global assessment to create a personalized treatment plan for somebody with low back pain.
Okay, so there's a wide range of problems that can cause low back pain. So when we get someone in who has low back pain, and keep in mind that the huge majority of the population, like 80-85% of the population, will have low back pain at some point in their lives. And that can be caused by an assortment of things. And it's important to get an assessment to see what's causing it, because you can't treat it unless you know what the cause is, and sometimes what's good for one incident of low back pain is not good for another, even if it's in the same person within a couple of years of each other, or even within a couple months. So when we get people in with low back pain, we're going to do an assessment of their movement, their strength, their nerve function. We're going to ask them all kinds of questions on what makes it better and worse, how long has it been. We need an understanding if there's something that they know of that caused it. Maybe they don't, but if they do, we want to get a really good understanding of what caused it, when did it start, what's making it better and worse, and then we do our assessment to nail down what the cause is. And then once we figure out the cause, then we can treat it appropriately and diagnose, and make a good prognosis, depending on what the condition is.
So sometimes people come in looking for specific treatments, like gun IMS, which is an advanced dry needling that you provide. Can you give an example of what you might see in a back assessment that would guide you to suggest that that person receive gun IMS as one of their treatment strategies as part of a full treatment plan?
Right, so typically with gun IMS, you're looking at someone who's had low back pain, or that's what I'm treating with the IMS, for a period of time. Usually it's 3 months or longer. And what happens is the nerves become sensitized, and we get other signs that are very clear to us in the clinic when you come in that you have that type of pain, which will benefit from IMS. Not everyone benefits from it. It's important not to just do IMS on everybody. We do look for certain signs. We look for weakness. We look for changes in skin and muscle. We look for different pain patterns. And then we can kind of make a decision on whether or not IMS is appropriate. And if it is, we'll go ahead. But sometimes patients come in and they think they need IMS, and and they don't, and that's fine too. We can explain to them why maybe it wouldn't be as beneficial for them, and why maybe another treatment would be a better option in that case.
Yeah, and that's the advantage of seeing someone with your experience, right? You know, that you can look at the big picture and really make the recommendation that's going to help the person get the results that they're looking for, right?
Right.
So how about we talk about another kind of problem that we do see quite often here at Global Physiotherapy, which is a combination of neck, shoulder, arm, maybe one or all three. What kinds of things should people look for to help them know that they would benefit from getting neck treatment?
So this is a very common thing that we see. People might come in with neck, shoulder, and or arm pain, tingling, numbness. It's very common. So step one, after we have to get their history, and that gives us lots of information. But the first thing we have to do as a physio is what's causing it. Is it coming from the shoulder? Is it coming from the neck? Is it coming from the elbow, sometimes with different conditions? So the first step is to get a good history and then do some movement testing. We do some nerve testing to make sure, to see if it's coming from the nerve. Lots of times people come in, they're like, my shoulder, and you do the assessment, it's like, oh no, it's the neck. That happens quite a bit, and it's important to be able to decipher the two, because if we are treating the shoulder and the problem is the neck, then the shoulder is not going to get better. And so it's important for us as physios to take the time to figure out what the actual problem is, where is it coming from, and then what is the best treatment for that. And also to explain it to the patient, because if you don't know, if you don't understand, or you can't see that the pain is coming from your neck and it's coming from your shoulder, then it's going to be harder for you to manage it, because you're not going to realize it. So we understand the importance of explaining everything to the patient very clearly so that they understand. It makes them more motivated to do their exercises and to look after themselves and to come back and continue on what they need to do to get better.
Yeah, and I agree with you. We really do see a lot of those upper body problems, And I really like one of our new initiatives, providing printout of a plan of care to our new patients, because we were realizing that they really needed that information when they go home, because we do provide a lot of education during our session, but then sometimes it can be overwhelming, and then they go home and have questions, and so we're really trying to help fill that gap and improve how people understand the plan that we create with them, right? It's a treatment plan with the patient to make sure that we're focusing on achieving their goals, whether it be a vacation 6 months from now or running a marathon. That we want that clear idea from people coming to see us, because we value movement. And so those are 3 great examples of many that Leasa sees in a day. So let's wrap up, Leasa, with how about highlighting some of the things that you enjoy about practicing at Global Physiotherapy, some of the things that set our practice apart from other physiotherapy experiences people might have.
Yeah, I mean, I worked at a few clinics in Nova Scotia. I worked in Fort McMurray, and I've worked in a couple different clinics here in not in Sherwood Park, but in Edmonton area. And I have to say that this is my favorite. I might be biased, but this is my favorite. And I'll tell you why. Individual rooms is really important. I've had to fight at other clinics to try and get a room just to do an assessment. I've had to really insist. But here, all the rooms are individual. There's no curtains. It's privacy. You get lots of time, which is another reason I like it, is that we have lots of time to spend with the patients. One-on-one time. I really appreciate that, because I feel like it doesn't matter how good a physio you are, if you don't have the time to spend with them, it's frustrating for the patient and for the physio, to do a good job. We all want to have the time to do the best we can, right? So I like that. And our team. We have a really experienced team. Everyone's got years of experience here, and we really respect each other's differences in some of our approaches, and also our knowledge. So there's many times we are talking, if someone is having trouble with one patient, we might talk about it, like, how could I handle this, or maybe I need to refer to recommend another physio, because we are ultimately more interested in what's best for the patient. And I really appreciate that here. We're all very patient-centered, and unfortunately, it's not like that everywhere, but it's a very positive environment to work in. I really do like working here. Yeah, it's good.
Yeah, we do like that. I like that
we are
myself.
A good team.
And as Leasa said, I really encourage each professional to pursue that area of interest, because I like that we do have areas of expertise, so that we can have that team approach to provide to our patients. So I think we should end with your special interests, because I think that's important in getting to know you. So what do you like to do? What do you volunteer in? Just maybe name a couple of highlights that influence your pleasure, how you like to be active.
How I like to spend my time? Well,
yes.
I do yoga. I go to the gym. I don't love the gym, but I make myself go. I really like yoga though. And my kids. Oh yes, I like spending time with my kids too.
Yeah, like all of us on the team, we're all parents, and Leasa has adult children, as do I.
Yeah.
So I think that's great. Gave us a chance to get to know different aspects of your clinical practice, Leasa, and stay tuned. We'll do an update later in the year.
Thanks. Thank you.